a 19-year-old girl who has the same name as one of my daughters, and came to us when this girl was 12. She got a tick bite on her thigh. She had the classic bullseye rash. She had a neuropathy that developed down her leg afterwards with numbness and tingling, and then weakness, so that the weakness would come and go, but she would have periods of being unable to walk, and went through all of high school, junior high and high school, with pain and disability. Besides that neuropathy, and which turned into severe pain in that leg, she had fatigue, the joint pains, cognitive problems, headaches, quite a list of other symptoms, but was a very self-motivated, smart girl who managed to play, I think it was softball, graduate with great grades, and wanted to do work helping kids with seizures and other developmental disabilities, but was struggling to be able to work 2 hours a day. Severe pain and problems. Then, about last summer, she got another tick bite on her shoulder over here and developed a similar neuropathy in her left arm, and so had severe pain and weaknesses in her, one arm and one leg, and this really beautiful, young girl that should be in the prime of her life. And she came to see us for a cannabis, consult to see if she could start using cannabis. Had noticed that using, smoking THC-dominant cannabis gave her more relief than all of the prescriptions that she had been given with much less side effects. And so, had a discussion with her family about it, and after much debate and speaking to other doctors, had come to see us. After listening to her history, she had also, done some various evaluations with infectious disease specialists and other people who had thought that no testing for Lyme was indicated, even though she had the classic bullseye rash, and had been through all the other testing to see what else could be causing this problem with no other good suggestions or options for treatment. And so, besides providing her with the information about how to use cannabis, we did more testing and ultimately diagnosed her with Lyme and started testing for co-infections and other things. And so different things were happening at the same time, and that's what's often happening. She had already started getting great benefit from cannabis. We helped her be in a regimen that was more, provided better results and was sort of easier for her to use and be higher functioning, replacing smoking with oral methods and helping her optimize that. And so that helped her a lot. And then starting antibiotic treatment, which initially made her worse, which is a common thing that we see in Lyme, and then started making her better. Before that, we did other things to help her detoxify and kind of decrease that worsening that happens before, and integrative treatment to support her in lots of ways. She's the best she ever has been in her life. She still has the neuropathy, and the pain in her arm and her leg gets decreased, and she's managing it much better. But her fatigue is gone, her brain is cleared, she's able to work full time, she's feeling great. She had times of depression and anxiety that I think were quite understandable given what she was experiencing. Not experiencing any of that anymore, really so full of hope, hasn't had headaches, hasn't had joint pain. All of her symptoms, except for that neuropathy, are improved, to the point that her father came to see me for a visit, to help with his chronic symptoms, and sent us a letter saying, our daughter's seen 18 other doctors and nobody's been able to help her, and now we have her back. And instead of struggling through each day, she's smiling and happy and, able to work hard. And so that's wonderful, because that's somebody, I think, who can go on to have a huge impact on many people in the world. I think the first part definitely is diagnosing them. Do they have Lyme or not? Is this, and what stage is it? Is this a Lyme infection? That's what we call late disseminated Lyme disease. that hasn't been diagnosed and hasn't been treated and has gone on to be a severe illness? Is this Lyme that was treated, maybe for a week or a few days with antibiotics, but not completely? Or is this somebody that's had Lyme, that's been properly treated, but has remaining symptoms? I think figuring out, is there an active infection, or is there just inflammatory conditions afterwards, or is there a combination of both? And then commonly people may have been diagnosed with Lyme but never tested for the other infections that ticks carry. We call them co-infections. The most common of those are Babesia, Ehrlichia, Bartonella. And then even after people have been treated, there's a lot of kind of rebuilding with life and rehabilitating that happens. In treating Lyme, I think antibiotics obviously is one big component, or antimicrobials, identifying the infections that are involved and then treating them appropriately. There's so much controversy in every area of Lyme about what's the appropriate duration of therapy and how do you know when you're done. And then, what else to do besides that? I think that from what I've seen, most people who have had an infection that's gone untreated for many months to years usually need more than antibiotics to get better. They need a really integrative, holistic approach, that encompasses every area of their life, their nutrition, their supplements, their other hormone systems, their immune system, their digestive health. And most people, I think, need to be on some sort of maintenance therapy. And usually, given the risks of antibiotics, we can do that with herbal antimicrobials and other things to support them. These are information that's provided for physicians by the specialty fields and the institutions that sort of tell us, well, this is how you would treat this condition, and this is how you would work up this problem, or this is what this medication is appropriate for. And in cannabis and in tick-borne illnesses, that is weaker than I would like to see it, and it leaves doctors really needing to go to that preclinical research, look at the guidelines, understand why they're made, where that's coming from, instead of just trusting them and taking them at face value. And then listening to our patients and really working with them, communicating with other doctors who are kind of on the grounds treating people, collaborating, tracking our results. And that's fun. I think that challenges us to a higher level of practice, and is so rewarding when we get to see patients getting better that medicine has, others in medicine haven't been able to help. And we see that so often, and it is just so wonderful to see these people getting better and getting their lives back and going on to be people we work with in the community and activists and helping other patients. I think Lyme is a disease or an infection that can affect every area of the body and cause a wide range of symptoms. Having said that, there are some commonalities. I think that for most people, they find that using a combination of CBD and THC is helpful, with more CBD in the daytime and more THC in the nighttime. And for some people, that'll be like a 1-to-1 ratio with even amounts of each during the daytime. And for other people, it's almost all CBD with a little touch of THC during the daytime and then more THC at night. THC is I would say definitely the most beneficial component of cannabis for pain, for sleep, for neuropathy, for seizures. We've got the most research on it. We understand most how it works. I think there's a lot of fear because that's the only component of cannabis that is psychoactive. It definitely has the most side effects, even though compared to every other prescription I've ever written, I think it has the least. Maybe not every, but it has a very low side effect profile with a lot of safety. And then starting with low doses and working up. And I think those are the components that I would really hope every patient out there understands. Start with a dose that's you don't expect to do anything, that's going to prevent you having any side effects, and that's going to allow you to be able to recognize your optimal dose when when you get to it or when the patient gets to it. And so, very simply put, start low, go slow. Don't be afraid to go all the way. For Lyme in particular and tick-borne illnesses and other infectious diseases, including some raw cannabinoids or acidic cannabinoids, THCA and CBDA, and using cannabis in its raw form, whether it's via a tea that hasn't been heated for very long, boiled for a few minutes, or a juice or a pesto, or just incorporating little bits of it in food is very helpful. And it seems as though those patients are getting some antimicrobial benefit as well as the relief from the symptoms that they're seeing with Lyme, the pain, the neuropathy, the anxiety, the sleep, the cognitive dysfunction.